Hi, I'm Margaret Larson. Welcome to this special episode of Facebook Live. We're talking about a problem that people face all the time. How do you know when to go to the emergency room or when to choose a less expensive option? So today we're talking from Premera Blue Cross with the medical director of provider engagement, Dr. David Buchholz, and it's good to see you again. We've talked on several occasions. So let's talk first of all about what the ER is for and what it's not for, so that we can kind of have that in our minds when we make that initial decision.
Yeah, you know, emergency rooms really are for life and limb-threatening emergencies. It's when you're thinking that you could die, or that you're experiencing something that if it's not treated immediately, truly immediately, you're going to have some sort of long-term impairment. It's not for routine care. It's not for even minor injuries. It's really for life-threatening emergencies. You almost have to think about, do you think whatever you have is going to cause you to be hospitalized, either for a surgery or a procedure or whatever? That's a really good litmus test of figuring out whether or not to go to an ER or not. Yeah.
So if it's not life-threatening, what are your choices?
Well, you know, if it's not life-threatening, like it's not considered a true emergency, you have urgent cares, walk-in clinics, there's retail clinics, and I always in favor of first calling your primary care provider. If you have a pediatrician, internist, or family medicine doc that you're comfortable with, call them 24/7.
Also nurses' lines. Will you remind people about how to use those?
Yeah, most insurance plans have nurses' lines. They almost always have the phone number on the back of your insurance card, so just look to see if it's there. They're great for triage. Essentially, they ask you a lot of great questions, what's going on, and then they can help you figure out what's the best level of care. Is this something maybe you can just do at home with basic first aid? Maybe you can wait to call your doctor the next day. Maybe you need to go to the emergency room. They can help you through that process. So if you have time to call the nurse, it's always worth doing it.
So there's urgent care and there are walk-in clinics, and I think a lot of people don't even know where the nearest one is. Right. How do we know which of those two is appropriate, and how do we know that they're the kind of place that we would want to go, that are fully staffed and have good care available?
Yeah. I think that's why people go to the ER, because they just assume they're going to have everything you could possibly need.
Well, they are.
And most of the time they are. We can talk about some exceptions later. Urgent cares, by definition, are supposed to have x-ray machines. They're supposed to have lab facilities. You should be able to go to an urgent care and leave with a diagnosis. For example, if you really think you have a broken bone, they should be able to x-ray you.
Got it.
Walk-in clinics are very much just like a doctor's office. Some doctor's offices have x-rays, some have labs, but they don't necessarily do. So if you think you need an x-ray and you're going to go to a walk-in clinic, you should probably call first to see if they have one, because that might be the choice of going to an urgent care. And then the retail clinics, now that are in a lot of the drugstores, they often have minimal services. They're really only treating the most basic things. They never have x-ray. They rarely have a lab test, except for maybe be able to test a urine for a bladder infection. And they often don't really want to see small children. So you have to be careful about where you go.
Let's talk about kids, because oftentimes you're headed to the ER or someplace else with a kid who's got a sports injury or has the croup or has a terrible cough, something like that. Should you call ahead and find out, does my urgent care walk-in clinic have pediatric services?
Yes, you absolutely should, because the worst thing is to go to a walk-in clinic or an urgent care and then realize they can't see you and have to turn around and go somewhere else. So that's why I think everyone, just like we need to prepare for earthquakes in the Northwest, we have to prepare for various medical conditions. And it's going to be different for each member of the family. If you're a small child under 3 months of age, it's a totally different answer than if you're a 2-year-old or a 50-year-old.
Well, let's talk about that. You're a new parent, you've got a 2 or 3 month old baby, something unusual is happening, let's say a fever, something like that. What do I do? Because I'm probably freaked out, right? I'm a new parent, this is a very small infant.
Well, Margaret, I'm a general pediatrician, and I really tried hard to anticipate all of those types of questions when I took care of patients and their families. And so almost always educated my parents on what to do. But it's still, you often don't remember, and you often didn't remember to ask the right questions, or maybe I didn't remember to tell people. But if you think you have time, just call your pediatrician. You can call them 24/7.
So even after hours.
Even after
start
hours.
there.
And it's very possible you'll get an answering service or a nurse line, just like an insurance plan might have. And they can help you through that process. And if they can't answer the questions, they'll contact your pediatrician and have them call you, or the person covering. It's when you have time, it's always worth doing that. There's only a few things that kids really need to go to the emergency room for. Newborn infants with a fever is always an emergency.
Okay.
So under 3 months of age, go to the emergency room. Difficulty breathing. And
I was about to ask
Yeah.
about like airway obstruction
Yeah.
and difficulty breathing, because who hasn't had a child who hasn't swallowed something?
right, or has a bad cold,
Yeah.
cough, croup, something. So it's, especially in small children, if you are listening to the way they breathe, you'll probably make the wrong choice on where to go. You have to look at how they're breathing. And if a child seems to be comfortable getting air in and out, even if it's incredibly noisy, it's
Right.
probably just in their nose, and you can probably just use an humidifier.
Interesting.
But if they're starting to work hard to breathe, they're using chest muscles to force air in and out, that's becoming more of an emergency. If it's a small child, you go to the ER. If it's an older kid, say maybe more than 2, you probably can go to an urgent care.
Good advice. Another thing that happens, sorry if you're eating your lunch, but vomiting, that kind of stuff that seems to go on and on. We really
Yeah.
worry about kids being dehydrated, or
Right.
what is this that's causing this? How do you make a decision there?
Yeah. Well, when a child starts to vomit, it's always scary, because even as a pediatrician, I don't know why they're vomiting. And it could be anything. It could be a brain tumor. It could be the worst scenario. It could be incredible things. Once the diarrhea starts, then you know it's the stomach flu, and you can actually start to relax. But when a kid's vomiting, you usually want to withhold anything that's going to make the vomiting worse. So most solid foods. You just start doing little sips of clear liquids, usually water or Pedialyte. Try to avoid milk products, because that can make a kid throw up more. So you just start doing basic first aid and try to stay ahead of it. But if their hands and feet are cold, it's maybe been 12 hours since they've peed.
Then you worry.
Then
right?
they're starting to get dehydrated. Then it could be an urgent care visit if it's a bigger kid. But if it's a small infant, it's an emergency room visit.
Okay, let's talk about cuts, things that happen on the face or other visible areas.
Yeah.
When do you know to ask, and I'm saying this in part because my husband had a skin cancer removed from his face, and he's lost half an eyebrow, because we didn't think to ask about, is there a plastic surgeon we can see to do this instead? Can you ask for that when you're in the ER?
Yeah, you absolutely can, and a lot of times they'll actually offer it. It depends on where you are in the emergency room. I mean, where the emergency room is. If you're in Seattle, there's plenty of plastic surgeons that are on call and available. They'll come in, and so it never hurts to ask. And a lot of times I think people are afraid to ask a doctor's opinion, or maybe feel like they're challenging what they're about to do.
Do you know what you're doing, or do
Right.
I need a plastic surgeon?
And really, most docs are perfectly fine.
Okay, good.
They truly are. Now, a lot of emergency room docs, because they do a lot of suturing, might have even done some additional training, and they'll tell you, I've done some additional plastic surgery training. I can do this if you feel comfortable, but if you still don't, I'm happy to contact one.
Right.
And so you can always ask, and that's true of anything. If you feel, even if you're in an emergency room and you're not comfortable with the expertise of that particular doc, most of the emergency rooms in the Puget Sound have multiple docs. You can ask for an alternative.
Very good. Well, I don't want this to be the Tim Larson medical show, but I'm going to use my husband for one other example. We went to the emergency room. He had, it turned out, torn his bicep off the bone. The doctor in the ER did not know that for sure, but he said, you should probably check it out with an orthopedist. And then we found this out. He had to have surgery, blah, blah, blah.
Yeah.
My point being, talk to us a bit about follow-up, what you're told in the emergency room or urgent care to do. You should probably do.
You should probably do, though they tend to overdo it sometimes, just so you know. They have to cover their medical legal
I'm sure
stuff.
glad we went.
Well, that was probably a perfect example of going to an emergency room, because that actually is a limb-threatening problem. When the bicep tendon becomes detached, if you don't get it reattached, you lose function of that elbow, right? So that was perfect reason to go to emergency room.
Thank you. I feel very proud of
Very
myself.
good. That was a good choice. That's one of the ones I would have recommended. Yes, they'll almost always say, and in fact, in things that are truly sort of urgent follow-up, some emergency rooms will actually get you an appointment before you leave. It partly depends on when you arrive, of course.
Right.
If it's in the middle of the night, you should almost always follow up the very next day and talk to the right people, and then the orthopedist in your example will tell you exactly when you need to come in. Right. Sometimes you don't come in right away. With a broken nose, they actually want you to reduce the swelling, put ice on it for 3 or 4 days. You don't show up for 5 days. And then they'll be able to see how crooked or not it is once the swelling's gone and determine if they need to straighten it.
So let's talk about the patient experience. You go into the ER, wait times compared to urgent care or walk-in.
Yeah. Well, if you had the choice, let's say you have a condition that you're going to the emergency room that you could have gone to an urgent care, it's likely you're going to have a really long wait. Because when you go to an emergency room, they're going to place you with a non-emergency problem behind all the emergencies. Mm-hmm. And so you'll probably see a nurse within 30 minutes. They'll check you out, make sure you're not having an emergency, and then they'll put you in a room and you may be there for a long time. The average wait time for average time in the emergency room for a non-emergency is about 3 hours, but it could be much longer.
Right, that's a long time as compared to if you went to urgent care.
Urgent care, you get in, they just first come, first serve. You often can get out in 30 to 60 minutes.
And so what would you go to a walk-in clinic for, or one of these places at a drugstore? What kinds of things can they handle?
Well, let's start with the what we call retail clinics. Very minimal things. A cold, just to make sure you don't have a pneumonia, but even then probably that's too much. If you're an adult woman and you think you might have a bladder infection, that's a perfect thing. If you just want to know if you have strep throat or not and whether or not you need antibiotics, going to a clinic like that is perfectly great. They're really good at that kind of stuff. Anything beyond that, then if it's after hours, you probably want to go to a walk-in clinic or urgent care, and they'll take care of things like all of those things, plus they'll take care of, especially in urgent care, minor fractures, lacerations. Yeah, you'd be surprised how many broken bones really don't need much work.
Right. A related Facebook question, someone just asked, a lot of urgent care and walk-in clinics close around 7.
Yes.
So let's say
Yes.
your problem's not that big, but
Yes.
you're not sure that you or your kid can handle the pain overnight or whatever it is, then what do you do?
Well, that's actually really great. That comes back to the concept of planning. To really know, there are a lot of urgent cares out there, especially in the Puget Sound. We're really lucky. Some states have almost none. So even though your local one might close at 7, there might be one that's not that far away that closes at 11 or 1 o'clock. And so I would do that research first, but really if you have no options, I would call your nurse line or call your doctor. Find out, is it something that you can wait till the next day to do?
Okay, and the reason why I say this is such a good point is that I honestly, as many times as we've talked about things like this on New Day, I don't know that I've identified where an urgent care is near me or a walk-in. I know what's at the drugstore just because I've seen it when I've been in there. So you would recommend that we not only kind of map out where they are, but give them a call ahead of time, find out if they have a pediatrician, find out how they're prepared with lab equipment and that kind of stuff.
Right.
And then just have that in mind when you're going to do things.
Right, absolutely have that in mind. And a lot of insurance companies, and I'm a little embarrassed to say that Premera is not quite doing this yet, we are actually going to have all that information on our website.
That'd be great.
So you can just, on your mobile device, just put in your address and it'll give you the list of the urgent cares with the hours and the walk-in clinics and their hours and based on which one's closer.
That would be great. Yeah. Somebody needs to do an app, right? Where
yes.
your location. Oops! I just gave away $1 million idea.
Right.
Okay. Difference in cost between the ER. This is another question that came in. Between the ER and walk-in and urgent care, and why it matters even if we have health insurance.
Yeah, it matters so much. Let's talk about emergency rooms. Just by going to the emergency room, you're going to get a fee for the room. It's usually around $1,000. And that's not even being seen yet. It's just, and what that's really covering is high-tech devices that they have in emergency rooms, highly trained staff, nurses, and those kinds of things. And then on top of that, you're going to get the physician fee. So an average cost in emergency room is probably about $1,200.
Wow, and it can easily run to $5,000, $8,000 for simple things.
For simple things. And if you get back to my concept, you really shouldn't go to the emergency room unless you think you're going to be admitted. if you're admitted from the emergency room, actually the emergency room becomes part of the hospital costs, and you have no cost at all.
Interesting. It just
it's part of the
goes right
hospital
over.
stuff, right? So that's a pretty much an easy one. If going to an urgent care, it's usually about 1/10 of the cost for the same kind of problem. Usually somewhere between $100 and $200. But if they're going to do an X-ray or something, it could be a little bit more, but it's going to be far less. Now, in most insurance plans, if you have a deductible, you may have to pay the entire emergency room cost because you haven't hit your deductible.
Right.
A lot of people have co-pays. Co-pays for emergency rooms average around $250.
They're different than a doctor's visit. So can these places refer among themselves? Like if I walked in the ER, could somebody say to me, you know what, you could really be better off with the urgent care, or do they just take me in?
They actually can't. There's laws against that.
They can't?
They can't.
That's something.
So if you, in some institutions where they have an emergency room and an urgent care next to each other, they'll often have somebody practically outside saying, why are you here, go that way, go that way. They can steer you in. But
that would be awesome.
Yeah. Once you've checked into the emergency room, there are actually federal laws that prevent you from turning you away. So even if you're there for the most simple thing, they have to see you.
Now, what about the reverse? I go into urgent care and they realize I need to go to the ER. They will tell me to go to the ER.
Oh, they're really good at that. And doctors' offices too. A lot of times people underestimate actually what's going on, and they'll show up in their doctor's office with chest pain, and they immediately will do what they can. They'll call medics and have you transported. Right. So it's not the best thing to do, but they absolutely will get you to the right level of care.
Do most insurance plans require that we call and get pre-approved, or if you think you have an emergency, you should just go?
No, those are the old days. Remember the days of HMOs?
Yes. That's all gone now?
You had to get permission. Absolutely, new federal laws. If what's called a prudent layperson thinks that they have an emergency, they can go.
Okay. Another question that just came in: how can we effectively use the 24-hour nurse line? And you said, first of all, check to see if you have one. Just look on the backside of your insurance card. Right. And then what's the best use of that?
Yeah, anytime, it gets back to the concept, if you have a life-threatening emergency, call 911 or go straight to the emergency room. Anything less than that, when you think you have time to call, it never hurts to call. They want to hear from you, they really do. And then be incredibly honest. Just the nurse will go through a series of questions about what your symptoms are, how long they've been going on, and based on that, they'll go through some algorithms, they'll just go through some decision tools, and they can give you advice on what to do at home, because maybe you don't need to be seen at all. I think that's actually remarkably common. They'll let you know if it's something that you really should go to an emergency room, urgent care, or maybe just call your doctor the next day and see your doctor. But they can really help you through that.
Yeah.
And I think a good example of that is going back to kids, and not to focus too much on children, but as a general pediatrician, I know it so well. If you think your child has an earache, give them Tylenol, basic first aid, call the nurse to sort of run things by, because there might be some variation depending on age and stuff, and they can give you some advice on what to do next.
So oftentimes this decision comes with kids, or at least it did with mine, on a sports field somewhere. Somebody's just taken a batted ball to the face or something like that, and you're freaked out, they're in pain, and you don't know what to do. Can you kind of give us permission at that point to just go straight to the emergency room, or should you stop and,
I wish
what do we do?
I wish I could. I have to say most often you can go to the urgent care.
Okay.
But there's some pretty clear guidelines. If you're on a play field, the common things are sprains, maybe even some fractures. Most sprains and mild fractures, broken bones, can actually be taken care of at urgent care, and I would recommend going there.
Yeah.
The kinds of broken bones, if you think there might be a broken bone, you can go to urgent care. If you know there's a broken bone, it's probably an emergency room.
Okay.
And the difference is if the bone's sticking out of the skin, that's an easy one, right?
Yes, that's an awful thing to experience as a parent or a person.
Right? Or if or if one arm or one leg doesn't look like the other one, because they're kind of deviated in some way, that's probably the level of an emergency room visit. Head injuries are another good reason to go to an emergency room. If someone gets hit in the head and they have a headache, that's probably an emergency room visit, especially if anything else is happening. Vision changes, difference in sensation in the arms and legs. they can't remember the injury, and people have to tell them, oh,
That's
didn't
a
you
big
know you got
deal.
hit in the head?
Well, and we used to do
That's
nothing about
universal.
that. Like when we were growing up,
Right.
somebody got their bell rung some way or another,
Right.
and they just sat on the bench
right.
and suffered a concussion or whatever. But we're taking all of that so much more seriously, and we're working into football season right now. So
It's a
talk to
perfect
me a little
time.
bit about parents evaluating what's happened to a child on a rough sport field like that.
Yeah, well, it's a great question, especially this time of year, isn't it? If a kid has, what we're talking about is a concussion, and even a little headache after a headbang, which like get your bell rung, is a mild concussion. They have to be out for the rest of the game, and maybe for a week or more. So, good coaches and good parents would never let their kid back on the
Right.
field, but when in doubt, keep them out.
Very good thought about that. There's also, we keep reading about these things where somebody has what appears to be a concussion, a knock on the head, and then they have a bleed or something that is
Right.
really, really serious.
Right.
So is that another reason to get
That's why
them
you go to
seen
the
right
ER,
away?
yeah.
Because you just don't know.
Yeah, because that's the difference, right? Because if you had a mild headache and nothing else after a sports injury, you might be able to go to the urgent care and be checked out. But the thing that the urgent care doesn't have is a CT scanner or an MRI scanner to look at your brain, because that's the most life-threatening thing that you really want to rule out. And so that's why, when in doubt, go to the emergency room in those cases.
All right. What have you seen over the years in terms of maybe somebody who should have gone to the emergency room and didn't?
Oh, wow.
And I'm asking that just because occasionally
Yeah.
people underestimate
Oh, yeah.
how much they're hurt,
Yeah.
or if you happen to be married to somebody who just won't go to the emergency room
Yeah.
unless they're bleeding profusely, and you need to talk to them about that.
I think the most obvious examples are really with adults, and adult women in particular, who have chest pain and are ignoring their heart attack. That's probably one of the more common things.
Because we have kind of different heart attacks, right?
Yeah.
They're not as the classic one that we hear about with men.
It could be low abdominal pain. It could be just a little bit of shortness of breath. It can be very different. So if you have a sort of an onset of some sort of discomfort in the chest or chest pain that's lasting more than just a couple of minutes, and you're the right age range, you're usually over 50, sometimes a little younger depending on family history, you really need to get checked out. That's a
attention
common
to
one.
that.
Strokes. People who have sort of sudden onset of some weakness in their face or slurred speech, or their leg doesn't quite move like they think it should, and it's been lasting more than a minute or two, you need to go to the emergency room. I think those are the kinds of things, they're subtle sometimes, and they don't want to be a bother. But with the strokes, there's some things you can do to prevent permanent damage.
And you
with
need to
heart-
get in there early, right?
Immediately. You
we
gotta
always
go.
want to pass that along. And the FAST test, which we can put up on Facebook as well to sort of see whether or not it's a stroke.
Yeah.
Another question that came in, this is really a good one. Should you go to an urgent care or walk-in clinic if you've run out of a crucial medicine? Let's say you just messed up, you didn't remember, and now you're out of meds and it's Friday night.
Yeah. Well, it depends on the crucial medicine. I would go to your pharmacy first, and most pharmacies have a branch that's a 24-hour pharmacy, and they're all interlinked now, unless it's an independent pharmacy, which are pretty rare. Pharmacists can give you a few days' supply.
Oh, so you can go in and say,
Yeah.
you've seen that I get this regularly. Can I have 2 or 3 of these
Yeah.
to tide me over until the next week? So
Yeah.
don't go to the urgent care
Don't
for
go to
that.
the urgent care for that. It's probably not a good thing. Then there's the class of pain medications, the opioids.
Let's talk about that.
Yeah, that's going to be a problem. Urgent cares, emergency rooms will not prescribe or refill opioids for you. And so the best thing to do is call your doctor. And even then, most have policies. They will not refill your opioid pain medications on a weekend or at night because of all the potential risk of abuse and redirection and all kinds of things. So doctors have to be smart too. When we write prescriptions, we often write prescriptions for a 30-day supply. That means periodically you're going to run out on a weekend. It really needs to be a 28-day supply.
Oh, that's a good thought.
Right? So that it always gets refilled on the day of the week, because you're going to run out on a
On a
Wednesday.
That's a really good thought.
So if and you can get that adjusted too. So again, with opioids or any narcotics, any controlled substance, you have to work with your doctor and work with your pharmacy to get on the right cycle, but it's absolutely worth doing to prevent yourself from running out on a weekend.
Right. There are also times when people have important medicines like migraine medications, things like that. Are those the sorts of things that pharmacists can make a decision about? So it's
Absolutely
really up to these pain
Yes.
medications that we're so worried about in
Yes.
terms of addiction at
Yes.
this point.
Yes, absolutely. Common ones that people will tend to run out on, insulins. That's an important thing for people with diabetes. Many of your common things like your high blood pressure medicine, even those are important. And they'll give you a 3-day supply just to get you through until you can talk to your doctor.
Right.
It's also important to remember that you should try to get 90-day supplies of meds. It reduces your risk. Make sure you have a full year of refills if you're really on a medication for a long time.
And that I know we've been talking about lately because of the hurricanes, having spare medication in an emergency kit. So that's worth talking about to your doctor before we get in that circumstance.
Yes.
So another question from a viewer: can you go to an urgent care if you realize, oh, we've got that about the medicine? Yeah, I've covered all of this. So talk to me about organizing our medications then. You know, a lot of us end up with, at a certain age, you're on 3 or 4 different things.
Yeah.
And what is your suggestion for making sure that we're organized, that we have kind of a schedule for getting our medicines renewed, and that we're not just haphazard about this?
Well, you know, that's a great question. Washington's passed a law that allows you to make sure that any medications that you're on a regular basis can get synced up so they're on the same refill schedule.
Yay, so you're not going to the pharmacy 3 days, out of 4.
Right, exactly. So that's the first step. Talk to your pharmacy, get synced up so that you're really refilling your regular medications on the same day every month. Go on the 90-day refill cycle if you can, and through mail order, and it will automatically just come to your home.
Which is awesome.
Which is totally awesome.
My pharmacist gives me a text message
Right.
and auto-renews a lot of things.
Mine
That
do
is
too.
so helpful because I used to run out of things all the time.
Right, and it's almost sometimes overdone, isn't it?
I'd rather know more than less. At least I know to go by and pick it up.
Exactly. So I think as a good rule of thumb, if you don't have those automatic reminders, even though you often can get your medications the same day or the next day, if it turns out it's at the end of the year of the prescription, they have to call your doctor has to refill it, your doctor might have wanted to have seen you before you refilled it. It gets much more complicated. Right. So sort of being aware when your actual prescription expires is also key. And then just my rule of thumb is when I'm down to 5 pills, that's when I make sure I call for the refill or go on my app.
Half a tank of gas, we go get gas.
Exactly.
But thinking ahead is important, and I've thought about that a lot with the hurricanes because I just thought about how many people didn't have an emergency kit, or they were away from, in Puerto Rico, for example, everything's gone. What older people? There are a lot of older people on the island. What in the world are they going to do?
And you can't even call for refills because no one has self-service.
You can't get a hold of anybody or drive anywhere or do anything like that. So my next question, since we've talked about pediatrics, has to do with older people because we're very concerned. Those of us who've been caregivers for elderly people, it's difficult sometimes to tell what's going on, and it does seem more frightening if there's a breathing problem, if they're ill. Are there any general guidelines you can offer us about that?
Yeah, it's interesting that older adults are similar to the infants. Fevers are always a concern. Even urinary tract infections are really concerned. So any sort of change from the norm, always think of your A, B, C, Ds. And A is for airways, B is for breathing, C is for circulation, and D I can never remember, but it has something to do with the brain, right? So I can never remember what the D is. But if you have any sort of sudden change, a change of awareness, change of interaction, it's very possible that if you have Alzheimer's or something, you're not that interactive anyway, but you sometimes see a sort of a sudden change. Those are always red flags. Cold hands and feet when they're normally warm is a red flag. Any sort of change in the breathing pattern could be many things. There are a lot of things older people can get where rather than having this nice in and out breathing, it can almost become panting-like.
Right, a struggle of some sort.
Struggling, and sometimes it doesn't necessarily look like a struggling, it's just different. So trust your instincts. When you know someone well, like because you are a caregiver, a change, especially if it's sudden, is almost always something to call a doctor about. But then at the same time, I'm probably getting out a little bit beyond my skill set as a pediatrician, but if you really are a caregiver and a person's towards the end of life, you really want to have those conversations as a family, like maybe you don't go to the emergency room when those things happen. Maybe you stay home. Maybe you call a nurse, because if they're near end of life, maybe it's better to die at home.
Wow, that is really something to have to think about, right?
Yeah, it's tough.
Better to sort of wrestle with that years ahead of time if you possibly can. Falls for older people.
Yes.
What should we do?
If you can't get up, you call 911.
Simple as that.
Yeah, simple as that. I think that's another thing people need to give themselves permission to do, and that's call 911. I think a lot of times they don't want to bother the medics, just like you don't want to bother the doctors sometimes.
I know it. I can't think of how many times we've raced to the emergency room in the car because we didn't want to bother the 911 people.
Right, because you're going to hit traffic, right?
Right.
So the medics do too, but they can get around it.
Exactly.
They have a lot of ways. So, if you're having difficulty moving, getting up, transporting someone, that's a 911 call. It really is. If you have a broken bone, broken hip, that any movement's going to be incredibly painful.
Well, you're right, and you might not be able to pick somebody up or move them safely
because it's so painful. So the medics can stabilize those kinds of breaks so that they then can move someone much more comfortably. Also, with falls, you have to worry about head and neck injuries. You might need to stabilize the neck. So call 911. Let the medics do an assessment, do the immobilization, and transport people more safely.
That's wonderful advice, Dr. Buchholz. Thank you very much. This has been very informative. We've covered cradle to grave and other things in between. That's it for us today. Thanks for joining us on Facebook, and we'll see you on New Day tomorrow.